In today's class, we are going to learn about pectoral region of upper limb. As you already know, we had learned about mammary gland, which is a gland seen in the superficial fascia of pectoral region. And once you remove this mammary gland, we will get into a region called region with muscles we call as pectoral region. So above this pectoral region, you can make out the highlighted part. Okay, this highlighted part is called as pectoral region. So about this pectoral region, before moving on to the muscles detail, first we have to know about the other layers which is covering these muscles. The layers covering these muscles are from above to below. We will be having skin, superficial fascia, deep fascia, and deep to these three layers we will be getting muscles such as pectoralis major, minor, subclavius muscle along with serratus anterior. So these are the four muscles we are going to deal in this class. So before going into details of these muscles, I will tell about some important points about the superficial fascia and the deep fascia present in this particular region. About superficial fascia of pectoral region, it is fibrofatty in nature, which is going to enclose the important gland we already dealt, that is mammary gland. And there is a special type of muscle present in the upper part of the superficial fascia that we will call as platysma muscle, which is seen near to the upper part of this pectoral region in the superficial fascia. And above this, we will deal detailedly in head and neck region. Just you remember for now, platysma, it is a subcutaneous muscle seen in the superficial fascia of pectoral region. And now talking about deep fascia, it is otherwise known as pectoral fascia. That's all about the details of superficial and deep fascia you have to remember. Now we will get into our important topics such as muscles of pectoral region. So in this picture you can make out the highlighted part. This highlighted part is called as right pectoralis major muscle. So first muscle what you are going to see is larger muscle which is going to cover whole of the pectoral region, which we will call as pectoralis major. So this pectoralis major, its origin, insertion, nerve supply and action I will tell you clearly later. Just you remember these things for your orientation. So pectoralis major muscle, it is taking origin from the medial side and getting inserted into the lateral side. You can make out clearly. So this is the origin part. The yellow demarcation what you're seeing is origin part, and then we will be having insertion present laterally. You can make out here. We will be having two parts taking origin from the medial aspect and getting inserted as a single tendon in the lateral aspect. So origin will be by two heads. We'll be having upper part and the lower part of pectoralis major taking origin from the medial side, and laterally it is going to get inserted. To view more about the insertion, we may take out a muscle called deltoid. If you move out the deltoid muscle, you can make out the insertion clearly. So here you can see another yellow demarcated area, that is nothing but insertion of this pectoralis major muscle. So here you will be having a bone called humerus, which is a bone present in the arm region. So this bone will be having some sulcus, grooves and many other tubercles, lips, such things. So in this lateral lip of the humerus is giving attachment for this particular muscle called pectoralis major. The important thing which you have to make out here is while inserting, the lower fibers of the pectoralis major is getting twisted here. So you will be having upper fibers here and this will be lower fibers. This lower fibers, it is going to twist around, then after it is going to get inserted. So while getting inserted in such a way, what will happen is this lower fibers go to the upper part and the upper fibers will go to the lower part while it's insertion, and this twisted manner, it is going to form a fold here, and that fold we will call as axillary fold. Anterior axillary fold is formed by this twisting manner of insertion formed by pectoralis major muscle. So these are the things you have to remember for the orientation of pectoralis major muscle, which is an important muscle seen in this pectoral region. So pectoral region, major muscle, what we see now is pectoralis major, and here you can make out some bones surrounding this, which is important for the origin and its insertion. So above the bone which you are seeing here is clavicle, and then we will be having another bone present in the median plane that we will call as sternum. So these are the two bones you have to remember in the medial aspect, and as I said before, laterally we will be having another important bone, that is humerus, which again you have to remember to know better about the origin and insertion of a muscle. So you have to know you have to keep in your mind, whenever you are reading muscle, the four things you have to explain. One will be origin, another thing will be where it is going and inserting, and then you will be having some nerve supply for this particular muscle, and the action of this particular muscle you have to explain. So these are the four important points you have to keep in mind while explaining about a muscle. After the pectoralis major muscle, what we see now, below this pectoralis major, we are getting another muscle, and that muscle is nothing but pectoralis minor muscle. So this is the muscle which we are going to see now. So this is pectoralis minor muscle, which is triangular in shape, which is present just below the pectoralis major muscle. Above this is a muscle again having its origin taken from medial aspect and getting inserted into the lateral aspect. So this will be called as medial, and this medial is giving origin, and laterally we will be getting insertion of this muscle. To view, this is triangular in shape. So this muscle, it is triangular in shape, and it is going to get its nerve supply by piercing. The muscle is pierced by a nerve called medial pectoral nerve. That medial pectoral nerve, it is going to supply this muscle. Along with that same nerve, it is going to supply the muscle which we seen before, that is pectoralis major. So medial pectoral nerve is a nerve which is coming from the brachial plexus, and then it is going to reach the pectoralis minor muscle, what we are seeing now, by piercing it. Later, after piercing, it is going to supply the another layer of muscle that is present just above the pectoralis minor muscle, that is pectoralis major. Here you can view the nerve clearly. The nerve what you are seeing is medial pectoral nerve, the nerve which pierces the pectoralis minor to supply that particular muscle. Along with that, it is going to supply another muscle called pectoralis major, which you have to remember. So origin, it is taking origin while you're seeing it is from costal ribs. So if you count, we will be having third, fourth and fifth costal ribs giving origin for this particular muscle and getting inserted into the coracoid process of scapula. You know, a bone is present behind the upper limb that we will call as scapula. So this scapula bone, it is again having many processes. Among that, one process we will call as coracoid process. So you to view, you can make out here. So this is the process which is we will call as coracoid process, the process which is coming from scapula. So this is the scapular bone, and it is giving a process anteriorly. That process we will call as coracoid process, which is giving insertion for this particular muscle called pectoralis minor muscle. So origin and insertion is in such a way, and about the other details we will deal later. So that's all about pectoralis minor muscle. Now we will move on to another muscle called subclavius muscle. So about subclavius muscle, It is same like other two muscles what we see now. So pectoralis minor, here you can make out here. Above that, can you make out a muscle, a small piece of muscle which is present above the upper limb, in the upper part of the upper limb, which we will call as subclavius. The name itself it indicates it is present just below the clavicle. So we are calling it with the name called subclavius muscle. So this subclavius muscle, it is a smaller muscle seen in the upper limb along with pectoralis major and pectoralis minor muscle, and this subclavius muscle, it is present just below the clavicle. You can make out here, same like other two muscles, it is taking origin medially and then getting inserted laterally. It is taking origin from first rib, from the outer surface of first rib it is taking origin, and then it is getting inserted into the clavicle. You can make out clavicle here. In clavicle, middle one third of clavicle, it is having one groove which is present below the or in the inferior surface of the clavicle. That groove is giving insertion for this subclavius muscle. So the groove present in the clavicle in the middle one third got a name called subclavian groove, as because it is giving insertion for this particular muscle. So we are given a name called subclavian groove, which is present in the middle one third of the clavicle in its inferior surface. So that's all about the origin and insertion of this small muscle called subclavius muscle, which you have to know. So about three muscles we have seen. One is pectoralis major, another one is pectoralis minor, and then we have seen now as subclavius muscle. The another one remaining is serratus anterior. So this is a muscle which is seen in the deeper layer of the pectoral region. So after removing the pectoralis major and pectoralis minor muscle, you can make out the layer of muscles with digitations, which we will call as serratus anterior. You will be having 8 digitations of this muscle, and we will call that as serratus anterior muscle. So this serratus anterior, it is again taking origin from anterior aspect and then getting inserted into the posterior aspect. So from costal ribs it is taking origin, as you can see this clearly, and then it is getting inserted into the posterior aspect, that is in the clavicular region. So in clavicular region you can make out the insertion of serratus anterior. So this will be latissimus dorsi. Here we no need of about this muscle, we will be having serratus anterior coming and getting inserted here. So you can remove the other muscles present here, such as deltoid and those things. So if you are removing all these things, you can make out here. So this is serratus anterior muscle. So this serratus anterior coming from anterior aspect getting inserted into a bone which is present here. You can make out an outline here. So that bone will be scapula. So in the medial border of the costal surface of scapula, we will be having insertion of this particular muscle called serratus anterior. So serratus anterior muscle taking origin from ribs in the anterior aspect, and it is getting inserted into scapula's medial border, that is in the costal surface. That's all about the muscles in the pectoral region you have to remember. I think now you are thorough with the orientation of these pectoral muscles, how it is arranged in our body. Now we will move on to the details about these muscles, such as origin, insertion, nerve supply and its action. So now we are going to see the details of pectoral region. So pectoral region, I believe you might have oriented now by seeing the videos as I shown before. Now we are going to see the descriptory part of this pectoral region, which you can understand in better way. So now in pectoral region, as I said before, we will be having 4 important muscles present in this pectoral region, such as first muscle we will call as pectoralis major, and second one pectoralis minor. Along with that we'll be having subclavius muscle and serratus anterior. These are the four important muscles which we will see in this pectoral region. Along with these muscles, you will see one important fascia covering the area which we will call as clavipectoral fascia. So these are the things which we are going to discuss now. So before going into the description of all these things, I have to tell you that we will be having pectoral fascia, that is deep fascia of the pectoral region will be called as pectoral fascia. So that pectoral fascia's elongation only nothing but this clavipectoral fascia, which I will explain you detailedly. Now we can move on to the muscle parts of this pectoral region. So first muscle what we are going to see is pectoralis major. Now about pectoralis major, you can see in this image clearly we have a bone above that we will call as clavicle and a bone in the medial aspect which we will call as sternum. In the lateral aspect we will be having arm bone that is humerus, which is bounded or closely packed by muscles, so you can't see clearly here. Okay, so now we are talking about this pectoralis major muscle which is forming the major contribution of this region. This pectoralis major taking origin from three important heads. So it is first taking origin from clavicular head first, that is the anterior surface of medial 1 by 2 of the clavicle. So medial half of the clavicle's anterior surface giving origin for the pectoralis major muscle. Then we will be having sternal head. Though so from sternum anterior surface, one half of the anterior surface of sternum giving origin for this pectoralis major. So we have seen two origins, that is from clavicle and from sternum. From clavicle it is from medial half of the clavicle anterior surface, and from sternum it is from one side of the one half of the sternum's anterior surface. Then we will be having some fibers arising from ribs also. So anterior surface of upper 6 costal cartilages also giving origin for this particular muscle. So these three origin you have to keep in your mind. One is clavicular head, another one is sternal head, which you can see clearly in your cadavers. Now we will be having and some more fibers coming, that is from the costal cartilages of upper 6 ribs. So upper 6 costal cartilages anterior surface also going to contribute for this particular pectoralis major muscle. Then we will be having some fibers taking origin from external oblique abdominis muscle. This is a muscle seen in the abdomen region. So this muscle is covered by a fascia that we will call as abdominis external oblique fascia. That fascia is also providing a small fibers for the pectoralis major muscle. So altogether four origin you have to keep in mind. One is clavicle from above, and another one is from medial aspect from the sternum, and another from the ribs cartilages. So upper 6 costal cartilages are going to provide origin, and from abdomen region we will be having fascia covering external oblique abdominis muscle also contributing for this particular muscle. That's all about the origin of this pectoralis major muscle. Now we will move on to its insertion. So pectoralis major muscle, how it is getting inserted. I think you will remember the first picture what we seen in the video. So that is insertion will be little complicated because it is not directly going and inserting into a particular region. It is making some modification while getting inserted. What modification we will see now? It is a inserting by means of a bilaminar tendon. Bilaminar in the sense it will be having two laminas. So above lamina will be there and lower lamina will be there into the lateral lip of bicipital groove of the humerus bone. So you have arm with a bone called humerus. In humerus we will be having a groove called bicipital groove, and in that groove we will be having on either side two lips. One is medial lip, another one is lateral lip. Among that lateral lip is responsible for the insertion of this particular muscle. So we will be having this pectoralis major muscle inserting in the lateral lip of the bicipital groove of humerus by means of bilaminar tendon. And then clavicle, how it is getting inserted? Clavicular head first you are taking, it forms anterior lamina. Same way sternal head, it is going to form posterior lamina. It then the posterior lamina alone will twist, so that what happens, upper fibers are inserted in the lower half and lower fibers are inserted in the upper half, and then it is getting inserted such a way. While it is twisting, what will happen, the lower part goes to the upper area, the upper fibers goes to the lower area. So this twist also will be seen in your cadaver. If you are seeing in axillary region, you can make out a fold anteriorly. That fold we will call as anterior axillary fold. That fold is formed by this twisting form of insertion caused by pectoralis major muscle. I think you can remember this clearly, the origin and insertion of pectoralis major. I can make out an image of this particular muscle which is easy for you to understand. So to summarize the model of pectoralis major muscles, origin and insertion, you have to know how the bones are oriented first. So wherever muscle origin and insertion is taking place, it is happening mainly in bones. So pectoralis major in upper limb, we will be having a bone called clavicle. So the clavicle bone, it is a bone which is present in the upper part, and we will be having clavicle here. So we'll be having clavicle in the upper part. Again, we'll be having another bone which is situated medially, that you all know, that will be called as sternum. So we'll be having sternum bone which is lying in the midline. So one half of the sternum you are seeing here. Then we will be having another bone present in the lateralmost part, and that bone will be called as humerus, the bone of the arm region. So humerus bone with its head you can make out. So we will be having humerus in the lateral part. So in humerus, major feature for this muscle attachment is bicipital groove. You will be having a groove present in the humerus shaft near to the neck of a humerus and body of the humerus. We will be having a groove called bicipital groove. See, the groove which you are seeing is bicipital groove, and this groove again will be carrying two lips. If a groove or depression is seen, it is mainly caused by two elevator ridges, and those things we are calling as lips. So this will be considered as medial lip, and the another one which is present laterally will be called as lateral lip. So lateral lip of bicipital groove is the one which is giving insertion of pectoralis major muscle. So now we are going to see the pectoralis major muscle on the whole, how it is taking origin and getting inserted. So now talking about the origin of this muscle, it is going to take origin from clavicle, from the medial 1.5, that is medial half of the clavicle, going to give origin for this pectoralis major muscle. So this pectoralis major taking origin from the medial half of the clavicle and from the anterior surface, and also it is getting origin from one half of the sternum. So this is the sternum part, and from the one half of the sternum we will be getting muscle arrangement taking origin from this one half of the sternum part also, and also it is taking origin from costal cartilages of upper 6 ribs. The ribs which is articulating with the sternum by means of costal cartilages are also responsible for the origin of pectoralis major. So two origins you have seen now, one is clavicular head origin, another one is sternal head origin along with costal cartilages fibers. Now again we will be having in the abdominal part one muscle called external oblique abdominis muscle. So this is a muscle where we will be having some fascia covering this muscle. So we will be having one fascia which is covering this external oblique muscle, and that fascia again it is going to give origin for this muscle called pectoralis major. So pectoralis major it is taking origin from the fascia of external oblique abdominis also, and this originated muscle are at last going to reach the lateral lip of bicipital groove of the humerus and then getting inserted. While getting inserted, what will happen is it is going to form a twist, and then it is getting inserted into the lateral lip of bicipital groove of humerus, and the upper fibers also it is going to come below and getting inserted. So this is the different way of insertion seen in the pectoralis major muscle. So this whole thing is considered as pectoralis major muscle, taking origin from clavicle, sternum, also from costal cartilages along with external oblique abdominis, and getting inserted into the bicipital groove where lower fibers are passing upwards and upper fibers are passing low downwards. So upper fibers will be seen in the lower attachment and lower fibers will be seen in the upper attachment. So that's all about the origin and insertion of pectoralis major. So to know further, just you remember this is clavicle and this is sternum part and this is costal cartilages, and this will be called as humerus with its bicipital groove, and this muscle is external oblique abdominis muscle, and this is the fascia. The green color layer what you are seeing is fascia of external oblique abdominis. That's all about the muscle pectoralis major. So pectoralis major muscle it is taking origin by four ways and getting inserted into the bicipital groove of humerus. So the pectoralis major muscle origin and insertion will be clear to you. Now we will move on to its next two important topics such as nerve supply and action of this particular muscle. So pectoralis major muscle, this is the cut section what you are seeing. So in cut section you can make out the anterior part as here. So this is the anterior part where you can make out pectoralis major, and in the deeper layer of pectoralis major you can see another muscle called pectoralis minor, and then we will be having fat surrounding these two muscles. So above the pectoralis major nerve supply you can make out two nerves are going to supply this muscle. So one nerve directly it is going to supply the muscle, and another nerve it is coming and then it is piercing another muscle which is present deep to the pectoralis major, that is pectoralis minor. Later it is coming out again and then it is going to supply the pectoralis major. So the muscle is supplied by two nerves such as medial and lateral pectoral nerve, but here you have to indicate medial pectoral nerve it is supplying the pectoralis minor by piercing it, and then it is supplying the pectoralis major muscle. And coming to action of this particular muscle, the clavicular head of pectoralis major causes flexion, and coming for sternal head it is going to form adduction and medial rotation of the arm. So action two in number, we are dividing into clavicular head action and sternal head action. Clavicular head it is going to cause flexion, sternal head it is going to form adduction and medial rotation of the arm. And these are the details about pectoralis major which you have to keep in your mind. Main thing from where it is taking origin and where it is inserting you have to remember. With the neat diagram you have to present in your exam, and along with that this nerve supply and action will be important for you for your practical purpose. And now we can move on to pectoralis minor muscle. So about pectoralis minor you might have already known the details such as pectoralis minor is a muscle which is seen deep to the pectoralis major muscle, and it is a triangular muscle. And here in this picture also it is clear it is a triangular muscle and it is going to take origin from the medial aspect and getting inserted into the lateral aspect. Now moving on to its origin and insertion. Origin of the pectoralis minor muscle is from third, fourth and fifth ribs near the junction, that is near the junction of costal and cartilaginous part of the rib. That junction we will call as costochondral junction. So the origin of pectoralis minor is from third, fourth and fifth ribs near the costochondral junction, and also the fascia covering the external intercostal muscles. So you will read about it later. The space between the two ribs will be called as intercostal space. That space again will be carrying some muscles called intercostal muscle. Among that one muscle we will name as external intercostal muscle. So this muscle again is covered by a fascia. That fascia is also going to contribute for pectoralis minor origin. So origin, it is mainly by third, fourth and fifth rib at the costochondral junction, and some accessory fibers taking origin from fascia covering the external intercostal muscle. Now moving on to insertion of this muscle. You might have already known it is getting inserted into coracoid process of the scapula. In scapula we will be getting three processes. Among that, one process we will call as coracoid process, and that process is going to give insertion for this pectoralis minor. To be particular, the medial border and the superior surface of this coracoid process is going to give attachment for this pectoralis minor muscle. So origin and insertion, it will be clear for you, and in simple way we can summarize as, so we will be having sternum in the medial aspect. As you already know, we will be having sternum in the medial aspect, and then we will be having clavicle above. As you already know, we will be having clavicle in the upper part, and then we will be having scapula here, and that scapula is going to bear a process, and that process we are going to name as coracoid process. So this diagram will not be so perfect. Just you remember, we will be having crow's beak like one process. That process we will call as coracoid process, and this coracoid process is responsible for insertion of pectoralis minor muscle. So from sternum we will be having ribs arising, so or ribs getting articulated. We will be having first rib, second and third rib, along with fourth and fifth rib placed here. So from here the origin of pectoralis minor takes place. How it is going to take place? It is going to take origin from third, fourth and fifth costal ribs, and then getting inserted into the coracoid process of the scapula. So this coracoid process of scapula is going to give insertion for this pectoralis minor muscle. So this is pectoralis minor muscle, and this is called as clavicle. Just for orienting, I have drawn clavicle, and the major part you have to remember is we will be having sternum, which is going to give articulation for these ribs such as first, second, third, fourth and fifth rib. Among that, third, fourth and fifth ribs are responsible for origin of pectoralis minor muscle, and here we have scapula and with a process called coracoid process. So we will be having coracoid process, which is responsible for the insertion of this pectoralis minor muscle. That's all about the pectoralis minor origin and insertion you have to remember for your exam purpose. Now we will move on to its nerve supply and action. So talking about its nerve supply, you know one nerve already, that is medial pectoral nerve, because it is a nerve which is going to come from the brachial plexus, and then it is going to pierce this particular muscle, and while piercing only it is going to supply the muscle. Later it is coming out, and then it is going to supply the another muscle called pectoralis major also. So here only one nerve supply will be seen for this particular muscle, that is medial pectoral nerve. Now going for the action of this muscle, it is going to draw the scapula. So it draws the scapula forward and also it depresses the point of the shoulder. The two action you have to remember, it draws scapula forward and depresses the point of the shoulder, and by depressing it is going to elevate the ribs, thereby it helps in the forced inspiration time. So at breathing process also it is going to help, that is during inspiration it is going to elevate the ribs. So one thing is it draws scapula forwards. Another point is it is going to depress the point of the shoulder and also elevate the ribs during inspiration process. That's all about the pectoralis minor muscle. Now we will move on to another muscle called subclavius. Subclavius, it is a smaller muscle you will see in pectoral region. This subclavius name itself it indicates sub in the sense nothing but below. So subclavius in the sense below the clavicle. So below the clavicle we have this muscle, so we are naming it as subclavius muscle. In this diagram you can make out clearly it is coming below the clavicle and it is taking origin from first rib and getting inserted into the clavicle itself. So coming for origin, first rib at the costochondral junction. It is taking origin from first rib at the costochondral junction. In picture you can make out a bi-demarcated area that is going to indicate cartilaginous part, and the bony part, that is brownish area, which is going to indicate as bony part. Okay, that is costal part. So costochondral junction of first rib giving origin to subclavius muscle. And now coming for insertion. Insertion, it is seen in the lower surface of the middle 1/3 of the clavicle. So in middle 1/3 of the lower surface of clavicle you will see a groove. That groove is called as subclavian groove. Because of this reason, that is it is going to give insertion for subclavius muscle, so we are calling that particular groove as subclavian groove, which is seen in middle 1/3 of inferior surface of clavicle. That's all about origin and insertion of subclavius. Origin from costochondral junction of first rib and inserting by moving upwards to the middle 1/3 of the inferior surface of the clavicle. And to summarize, again we can see a simple picture of it. So now talking about subclavius muscle. This subclavius muscle will be taking origin from the first rib to the clavicle, right? So you know already these points. This is nothing but clavicle, which is seen above, and here we have sternum. So this is sternum, what you are seeing, and here we will be having this as first rib. So this is costal part and this will be cartilaginous part. Okay, so now we have the subclavius muscle and this is taking origin from the costochondral junction. From this junction it is taking origin of the first rib and then getting inserted into the middle 1/3 of the clavicle. So here we will be having one groove which we will call as subclavian groove. In this groove it is getting inserted. So this groove which is seen inferiorly will be called as subclavian groove because of the insertion of this particular muscle. So subclavian groove giving insertion for subclavius muscle, which is seen in the clavicle, getting origin from the costochondral junction of the first rib. From here it is taking origin and getting inserted into the subclavian groove. That's all about the subclavius muscle, which is seen below the clavicle. So we are calling that as subclavius muscle. So I think you will be clear with origin and insertion of these three muscles such as pectoralis major, minor and subclavius muscle. Now we will move on to nerve supply and action of this particular subclavius muscle. Nerve supply of subclavius muscle is from nerve to subclavius which is a direct branch coming from the upper trunk of brachial plexus. And action of this muscle is it is going to steady the clavicle during shoulder movements. It is a small muscle, and so it is going to give one important action, that is it steadies the clavicle during shoulder movements. And nerve supply, if you are thorough with brachial plexus, you might be knowing brachial plexus, it is having the upper trunk. From the upper trunk we will be getting one separate branch which we will call as nerve to subclavius. That is the nerve responsible for the innervation of subclavius muscle. So these three muscles got over, which are very important in pectoral region. And now we will move on to another muscle which is seen as a part in pectoral region, that is serratus anterior. So this name, why serratus anterior came? Serratus in the sense like tooth like appearance we will call as serratus. Serratus anterior in the sense it is present in the anterior aspect. So obviously in our body there is another muscle called serratus posterior, which we will deal later. Now for our pectoral region we are going to deal with serratus anterior muscle. So this serratus anterior muscle origin. The origin of this serratus anterior is by means of 8 fleshy digitations coming from upper ribs and fascia covering the intercostal muscles. So all these fleshy digitations are coming from upper ribs and also from fascia covering the muscles present in the intercostal spaces, and then inserting into the medial border of the scapula in the costal surface. You can make out clearly in this picture. We already have seen, but still in this picture also it is very clear. It is taking origin from first 8 ribs along with the fascia covering the intercostal muscles by means of 8 digitations. Later it is converging together and getting inserted into the medial border of the scapula of the costal surface. In scapula, we will be having two surfaces. One surface is anterior surface which is facing towards the ribs. So we are calling that as costal surface. So that costal surface medial border giving attachment for this particular muscle, which we will call as serratus anterior. Talking about the insertion of serratus anterior muscle, and it is again we can divide into 3 slips, such as we have 8 digitation. In that first slip of the serratus anterior, it is going to the superior angle of costal surface of medial border of scapula. So we have 8 digitations. Among that we are dividing into 3 groups, first, second and third group. First group it have only first slip or first digitation which is going to the superior angle of costal surface of the medial border of scapula. In the second set, that is second and third slip, it is going entirely to the costal surface of medial border. And happening to coming for the third session, in third section we will be having 5 slips. So remaining 5 slips are going to insert into the medial surface of inferior angle of the scapula. So we are dividing the insertion of serratus anterior into 3 parts: above, first, second and third part. First part will be having only first digitation, and second part will be having second and third digitation. The remaining 5 parts, the 5 slips, will be seen in the third part. So first slip going to the superior angle, and second part going to the costal surface of medial border. Last 5 slips which is going to the inferior angle of the scapula. That's all about the origin and insertion you have to remember. So serratus anterior, it is very simple. It have 8 fleshy digitations which is taking origin from first 8 ribs along with the fascia covering the intercostal space. And insertion, it is happening by 3 ways. One is to superior angle, other 2 are from second and third digitations going to the medial border, and remaining are getting inserted into the inferior angle of the scapula. And now we can see the simple image or simple way of drawing this serratus anterior muscle. You can make out here we'll be having some bones related to serratus anterior muscle such as sternum along with the ribs articulating to the sternum, and then we will be having posterior aspect bone, that is scapula. Now we are going to see the origin of serratus anterior. As I already said, it is taking origin by means of 8 digitations. So we will be having 8 digitations such as first digitation, second, third, fourth, 5, 6, 7 and 8 digitations of this serratus anterior, taking origin from the costal ribs, and then it is getting inserted into the medial border of the scapula. Consider this as costal surface of the scapula. In costal surface, this is considered as medial border, and this will be lateral border, and this will be superior border. And here we will call this as superior angle, where you can make out the insertion clearly. So this muscle altogether we will call as serratus anterior muscle. So this will be serratus anterior. And talking about the origin, as I already said, it have 8 digitation, and these 8 digitation are getting inserted in different way, such as the first digitation. So first digitation of this serratus anterior, that is first slip, it is getting inserted into the superior angle of the medial border of scapula. So this is superior angle of scapula, where we will be having insertion of first slip of serratus anterior. Remaining we are going to take second and third slip. So this second and third slip, it is getting inserted into the medial border. So this is the part where the insertion of second and third slip is going to happen. So this is fully on the medial border of the scapula. And coming for remaining 5 slips, so we have 4th to 8th slip. So these 5 slips are going to get insert in the medial border only, but in the inferior angle. So here we will be having inferior angle of scapula, which is going to give insertion for this last 5 slips of the serratus anterior. So whole together we have the whole big muscle. We will call this as serratus anterior. The insertion only will be different because we are going to divide the insertion of this serratus anterior into 3 parts, like upper fibers, intermediate fibers and lower fibers. Upper fibers to the superior angle, and the middle fibers to the medial border of scapula, and the lower fibers to the inferior angle of the scapula. That's all about the origin and insertion of serratus anterior, you have to remember. Now we will move on to the nerve supply and action of this particular muscle. Talking about the nerve supply of the serratus anterior, it is supplied by long thoracic nerve, which is otherwise known as nerve of Bell, which is coming from C5, C6 and C7 nerve roots. And coming for action, it is going to protract the scapula with pectoralis minor. So it have action accompanied with pectoralis minor, such as it is going to protract the scapula, and then it also will laterally rotate the scapula and also steadies the scapula during forced inspiration. It is used for keeping the medial border of scapula fixed to the chest wall. So these are the 4 function or 4 actions of serratus anterior. One action will be made along with the pectoralis minor, that is protraction of scapula. Other 3 are lateral rotation and steadying the scapula during breathing, that is especially during inspiration, and also keeps the medial border of scapula fixed to the chest wall. That's all about nerve supply and action. I think now you people will be thorough with all the 4 muscles with their origin, insertion, nerve supply and action. Now we will move on to the clinical aspect of these muscles. Going for clinical aspect, in this picture you can make out prominent medial border of scapula. This condition is due to paralysis of serratus anterior muscle. This condition will be called with a special name called winging of scapula. So this winging of scapula is responsible by serratus anterior paralysis. And then medial border of scapula is prominent and the patient is unable to do any pushing action. If a person is having this swinging of scapula, the patient cannot do any pushing action. The medial border will be very much prominent. And moving on to another important topic, as I said before, pectoral region with all four muscles, it is also having a fascia present there. That fascia we will call as clavipectoral fascia, which is very important for your exam purpose. This clavipectoral fascia, how it is taking origin and how it is getting inserted and how we can trace it out, all these details we will see now. Okay, so this clavipectoral fascia again will be pierced by some important structures. Everything I will teach you now. So coming for clavipectoral fascia, it is nothing but deep fascia lying deep to pectoralis major, and it is stretching between the costoclavicular and coracoclavicular joint. In this picture itself you can make out. So deep fascia which is lying deep to pectoralis major. In this picture they have removed pectoralis major. So once pectoralis major is removed, you can see a white fibrous sheath. That sheath we will call as clavipectoral fascia, and it is going to stretch between the costoclavicular and coracoclavicular ligament medially and laterally. So medially it is extending till the costoclavicular ligament joint. So it is going to extend medially to the costoclavicular joint, and laterally it is going to extend to the coracoclavicular joint. And then we will be having some attachments made by this clavipectoral fascia, such as if we trace superiorly this clavipectoral fascia is going to split to enclose the muscle called subclavius, and then it is getting attached to the lips of subclavian groove. As before only I had said, if a groove is present, two ridges will be seen on either side of these grooves. So we know in the inferior surface of clavicle we have a groove called subclavian groove. In the sides of the subclavian groove, on the sides of the subclavian groove, we will be having some elevation called the lips. Okay, so in those lips, we will be having attachment of this clavipectoral fascia. This clavipectoral fascia, after covering the lower part or deeper part of pectoralis major, it is going to cover whole of the pectoralis minor. Later, in the superior border of pectoralis minor, it is going to form a single sheath, and then it splits into two as anterior and posterior lamina. Later, it is going to insert in the inferior surface of clavicle, that is on the lips on either side of subclavian groove. So this is all about the superior attachment of this particular clavipectoral fascia. Now talking about medial attachment or medial tracing of this clavipectoral fascia, it blends with the fascia of first two intercostal spaces and also with first costal cartilage. Medially, it is going to blend with again a fascia which is going to be present in the first two intercostal space and along the first costal cartilage. So we have seen tracing of this clavipectoral fascia above and on the medial aspect. Now we will move on to the tracing laterally. This clavipectoral fascia laterally, it is going to get attached to the coracoid process. You know, the process which is like crow's beak seen in the scapula we will call as coracoid process. To the coracoid process it is going to get attached, and then it is going to get attached with the coracoclavicular ligament also. The portion stretching between the first costal cartilage and the coracoid process is thickened, and that thickening will be called as costocoracoid band. The thickening formed by this clavipectoral fascia, which is extending from first costal cartilage to the coracoid process, we will call as costocoracoid band. So this is the tracing which is seen in the lateral aspect of clavipectoral fascia. First thing you have to remember is it is attached to coracoid process, and then it is getting attached with coracoclavicular ligament, and it is forming a thickened band. That band we will call as costocoracoid band. So that's all about lateral tracing of this clavipectoral fascia. So now we have covered superior tracing, medial tracing and lateral tracing. The remaining is inferiorly how it is going to trace. So inferiorly, this clavipectoral fascia again splits, which is going to enclose the pectoralis minor, and then it blends with the axillary fascia which is present below. So this pectoralis minor, it is getting covered with clavipectoral fascia on the whole, and in the lower border of pectoral wrist minor muscle, it is again getting reunited. Later it is going to continue with axillary fascia, and this time we will call with a special name for this clavipectoral fascia, which we will call as suspensory ligament of axilla. So this is how this clavipectoral fascia is traced out in all the four directions. And this clavipectoral fascia have an importance that it is pierced by four important structures present in the upper limb. The important structures which are piercing this clavipectoral fascia are: first, a nerve which we will call as lateral pectoral nerve, which is a branch of brachial plexus, and then we will be having a vein called cephalic vein. All the four structures you can see clearly in this diagram. First one, lateral pectoral nerve, and then we will be having a vein called cephalic vein, and an artery or vessel which we will be calling as thoracoacromial vessels. Thoracoacromial artery along with its veins will be seen, and we will be having lymphatics to the apical group of axillary nodes. So we have already seen in mammary gland about the axillary nodes how it is divided into 5 groups. Among that, apical group of nodes also will be seen piercing the clavipectoral fascia. So four structures are getting pierced. One is vessel, another one is a vein, and then we will be having a nerve along with lymphatics. So nerve is lateral pectoral nerve, artery is thoracoacromial artery, vein we will call as cephalic vein, and then lymphatics to apical group of axillary nodes. So that's all about clavipectoral fascia you have to know. And to trace the clavipectoral fascia, we can make out a simple basic picture to remember it very easily. The tracing of clavipectoral fascia will be done in sagittal section of the pectoral region. So in sagittal section, the clavicle will be seen in such a way, and below the clavicle, we have a muscle seen in the groove. That muscle we will call as subclavius muscle. So subclavius muscle will be seen, and below the subclavius muscle we will be having another muscle present that we will call as pectoralis minor. So this will be called as pectoralis minor muscle, and then we will be having another muscle here that we will call as subclavius. So we will be having two muscles arranged in this way, and then above or in the superficial layer of these two muscles we will be having another important muscle or larger muscle which we will call as pectoralis major muscle. So this is pectoralis major, which is going to cover these two muscles. So this is pectoralis major muscle. So that's all about the muscles, how it is arranged in sagittal section. Now what will happen is these muscles are going to covered by the fascias, and in that we are going to deal with clavipectoral fascia. The pectoralis major muscle, it is already covered by a fascia called pectoralis fascia or pectoral fascia, which is going to cover whole of the pectoralis major muscle. And then we will be having another fascia, that is what we are talking, we will call as clavipectoral fascia, because it is related to clavicle and the pectoral muscles. So this clavipectoral fascia, it is seen surrounding the pectoralis minor muscle. So that tracing we can make out first. Before that, we will be having clavipectoral fascia. This clavipectoral fascia is going to be traced above by splitting into two and getting inserted into the lips of the subclavian groove. Here we will be having a groove which we will call as subclavian groove, and this groove will be having lips or ridges on either side, that is giving insertion for this upper or superior tracing of clavipectoral fascia. And inferior to this clavipectoral fascia, again this fascia is splitting into two on either side to surround this pectoralis minor muscle. After surrounding this pectoralis minor, in the lower border of pectoralis minor, it is uniting together, and again it is going to pass as a single fascia. Later it is going to form or continue as axillary fascia. This fascia only will be called as suspensory ligament of axilla. So suspensory ligament of axilla is nothing but clavipectoral fascia's inferior continuation along with the axillary fascia. So that's all about clavipectoral fascia you have to know. So this part is considered as clavipectoral fascia, which is traced upwards by splitting into two and getting attached to the lips of the subclavian groove by covering the subclavius muscle. In the inferior aspect, it is going to again split and cover whole of pectoralis minor muscle, and later it is going to unite together, and then it is forming a single layer again, which is going to attach with axillary fascia. The part which is going to attach with axillary fascia we will call as suspensory ligament of axilla. And I think you people will be clear with this pectoral region, where we have dealt with all muscles and clavipectoral fascia, which is very important for your exam purpose.